go ahead and call the meeting to order. This is the administrative hearing, as I mentioned, of October 26, 2020. The rules of decorum are strictly followed by the chair. Are there any additions or deletions to the agenda, Pete?
There are no additions or deletions to the agenda this morning.
We have one set of minutes to approve. It's for the administrative hearing of October 19, 2020. Commissioners, if you have no changes, the chair is currently open for a motion. Commissioner Justman.
I would make a motion that we approve the October 19th, 2020 meeting minutes as sent out.
Second.
It's been moved and seconded. All those in favor indicate by saying aye.
Aye.
Aye. Motion
Aye.
Thank you. And again, for the audience, we've had a couple people just come in. Commissioner Puglisi is at home with her children, where she should be. She's called in. Thank you very much for making that effort. And we'll go ahead. We do have one presentation today, a very important presentation. Every week it becomes very important, and that's for our update from the Mesa County Public Health regarding the response to the COVID. Dr. Kerr, you've had a very busy couple of weeks, and we're anxious to hear from you. If you'd introduce yourself, you may proceed.
Thank you. Thanks, Commissioners. Jeff Coor, Director of Public Health for Mesa County. Congratulations, Commissioner McGinnis, on all of the celebrations around McInnes Canyons. It's been great to read in newspapers. I think it's been awesome. So,
well, thank you.
We starting Thursday, I'm not sure if everybody knows this, but we had 74 cases Thursday, but then 81 on Friday. So this is, what we would call widespread community transmission, kind of ramped up. Saturday we had 33, which is, refreshing, and then yesterday we were back up to 47 again. So we have 10 hospitalized right now. I saw something this morning that in St. Mary's there are 13 total from the area, 8 of which I believe are Mesa County, and then the others are from somewhere else. 6 deaths. Our 2-week positivity percent has gone to 4%. With our old variants, that was important to stay below 5%, but certainly we want to keep that number down. To me, that's the best indicator because we are testing a lot of people. In fact, last Tuesday we tested about 644 at the fair. Every time I think we've reached our max, we have another really big day, and they just keep taking them in. So they're doing a great job up there. Then as far as the cases go, it's still our 20 to 29-year-old age group is still 10% above any other age group. So that's kind of our hot group right there. And then cause-wise, or source, still family members, 25% are family members. We had 117 in the past 2 weeks. Did have a big increase with some nursing home issues, so 43 cases, actually in the last week, 43 new cases associated with nursing homes. And then transmission through place of employment. So those are some of our little clusters or outbreaks. And speaking of outbreaks, we have 11 active outbreaks at this time, which involves 102 people. So we continue to monitor those. And an outbreak is cleared, so it's deemed no longer active if there's no new case within 28 days. So Commissioner McGinnis, as you know, everybody knows, but Commissioner McGinnis, you were with us on the call last week with the governor's office where we got moved back to the safer at home level 1. Which is called the cautious level. And what that has done to us is, so I'm just a few of the differences. Capacity is still 50%, but the cap went from 300 to 175. Bars that don't serve food have to close. Gyms and fitness facilities can only open to 25%. And then outdoor events are limited to 250 people. And then just a day or two after that, the state issued another order that limits personal gatherings to 10 people. So that's where we are now. However, we did ask the governor if we could continue with our 5-star or our variance protection program, and he did agree to allow us to do that. That's been an excellent program with the chamber. We have 91 businesses signed up. So through that program, anyone that is that achieves 5-star status, which is based off a visit from my team to go in there, and it's really just strict implementation of the guidelines, mask requirements, cleaning, 50% capacity. It's nothing beyond that, but just that these businesses are actually implementing those. And so we'll continue to do that, and then those that achieve 5-star will stay at the level that we were before. So their indoor capacity can be at 300, 50% for gyms. Bars that achieve 5-star that don't serve food can open under this. So it really allows for everyone to continue to participate as long as they're implementing those safety precautions. And I don't know if I mentioned this. We have 91 businesses up till last week. We have quite a few in the queue, as you could imagine. People are anxious to get involved with that. Otherwise, that's it. I'll take any questions that you have.
All right, thank you. Commissioner Puglisi.
Thank you, Mr. Chair. Thank you, Jeff. I know you've been working really hard, along with Commissioner McGinnis last week, to kind of try to find the right balance for Mesa County. Obviously, our numbers are going up, and there's not much we can do about that other than what we are doing to continue to keep our cases at bay. So if you had any recommendations for the public, I mean, is there anything that they can continue to proactively be doing in order to kind of avoid the community spread?
Yeah, thanks, Commissioner. Good question. Yeah, right now, in fact, we are getting ready to send a mailer out to every household. Our push right now, especially with people moving indoors for things, is to avoid crowds, avoid closed-in spaces, and avoid close contact. And if you can't, or if you're out and about, the mask is very important right now. You know, that's the one barrier, and especially considering the fact that we know that a lot of the cases that have started some of these outbreaks are milder cases, and so you don't know the difference. You may have sniffles and cold-like symptoms, and it may be COVID. So the thing that I think we can count on is to wear that mask when you're around others. And you know, as I mentioned, as we're going indoors, we don't know anything about the various air circulation and ventilation systems that we're walking into. So I think everyone should be aware of that, and you know, just continue to protect yourself, because you know, what we can do to work with various agencies we're doing, but really we need for people to protect themselves and then protect others, because that's been the source of the outbreaks. It's been a sick employee, a sick individual that's going into crowds, and you know, that's the area that we need to try to reduce transmission.
Thank you.
Thank you, Jeff. Oh.
Go ahead, Commissioner.
I just had one. Thank you, Mr. Chair. I just had one more question. Jeff, you said that the hospitalization rate right now for Mesa County residents is 10 people, and then 13, it sounds like, in the region. Can you remind us, what is that cap before our hospitals are overrun?
Well,
Dr. Kerr, why don't we do this? I'm not sure everybody in the audience can hear. It's very difficult to hear. Would you repeat the question, please, and then answer it?
Yeah. What should we be looking at hospitalizations-wise to be able to see if we're starting to put a lot of pressure on the hospitals? You know, a drastic increase first would be something that would be worthy of keeping an eye on. But when I met with all the hospitals last week, and to start talking about preparation because something could happen any time. But we know that even with our hospitals, if they're close to capacity with all sorts of illnesses, they could take a 20% surge based off of some alternate care sites that we have lined up, mostly out in Fruita. So we could handle a 20% surge in illnesses, which we assume would come from COVID, but and that would be a 20% surge over what they're at. So let's assume they're at 90% capacity, which I will say right now they're at about 45 to 50% capacity with beds from all illnesses. But if they were at 90%, they could still handle another 20% surge, and we could do it, but we would have to really, I mean, that would be serious enough that we would have to know that surge couldn't continue. So,
Thank you, Mr. Chair.
Thank you, thank you, Commissioner. Commissioner Justman.
Thank you. So, Dr. Jeff, are they the treatment at the hospital, has it been refined over some last spring till now that the treatment they can use or whatever it is working much better than it had in the early days, or is it basically the same run-of-the-mill treatment?
Yeah, it hasn't changed much what they're doing. You know, something was approved last week, but I had heard mixed, was it remdesivir? But I had heard mixed reviews on how effective that is. You know, but when talking to the hospitals now, their case counts are so low, I certainly wouldn't use this as a sample to determine the overall, you know, where we're going to be. But the cases have been pretty mild in the hospitals. But as I said, and we can look at other parts of the nation right now that their hospital systems are getting overwhelmed. So I don't want that to be an indication that overall this is very mild. I still think that you know, anything could happen at any time, and we just need to be prepared for it.
So are we close to getting a vaccine will be the end of the year at the soonest, or?
Yeah, I think talk last week was March for widespread distribution. I know that my team has sat on a call with the state for their distribution plan as well, so we are already talking about how the vaccine will roll out into the counties.
Is that from one single provider, or is that several different providers of different vaccines?
Yeah, I think 2 or 3 of them are about the same place in their evaluation right now, so I wouldn't assume it would be just from one.
But the vaccines are probably all one's a little bit different from the other, and I would imagine, is that true?
Yeah, well, I don't know that exactly how much they differ. Probably slightly, but probably the same basic principle. So,
Thank you.
You bet.
You bring up a good point, Commissioner Justman, and that is the question. So the distribution, I mean, they have several companies now that are manufacturing just the vials for each vaccination, in the billions of those,
Right.
or at least hundreds of millions that have to be produced, and the subsidies to get them to do it, because, I mean, and if the vaccine they come out with won't, so to speak, simplified fit in that little vial, then they got to make a whole bunch of new other ones. Then it's a pretty interesting study in logistics. Then to get those made, a lot of those, I guess, are being made in India. And then what proportion you share with the world, then to get into our distribution system, get them out, and then decide who gets to get it. It's really, really complex. And when you look at the political ads on both sides, they make it look like it's fairly simple and it ought to be here tomorrow. But the fact is, it's like moving an army. I mean, there's just lots involved. I have a couple of questions. One, so at the beginning of this, Dr. Kerr, the words seemed to be, and it kind of faded away, but anything you touch could give it to you. You know, whether it's plastic, and it's on your doorknobs for 24 hours, et cetera, et cetera. That seems to have all faded out. So is that not true anymore? Or now, I get it if you hug somebody, but you know, at the beginning, don't touch anything. But give us an update on what the latest science on that is.
Yeah, the frequently touched surface recommendation is still in the recommendations to avoid or for cleaning, but that dropped to the bottom of the list. So when you see the list from the CDC, that really is a list in importance. And so it really is the airborne transmission. But as we know, not everyone is going to sneeze or cough. And so, you know, some of the other ways to transmit this, for example, if you're at a bar with live music and it's loud, you have to be right next to somebody shouting back and forth to communicate. That's a really good way to transmit this. Singing, so anything that your expirations start to increase, that sort of launches it out into the air. So it doesn't just take a cough or a sneeze. So that's why gyms in reality are higher risk, and we've taken some extra precautions with the gyms as far as distancing goes. You'll see, you know, singing shouldn't be occurring unless there's precautions taken. So those are all around that, because those are other ways to get that virus airborne.
And let's talk about the 5%. So we're at 4%.
Yeah.
And And that's a 2-week rolling average, correct?
Yep, that's right.
And so what happens if we hit the 5%? What's the state do us at that point? Or do they give you a little time to see if that 5% is going to hold or grow? Or they immediately issue sanctions or something?
So right now where we are, 5% only applied to our last level that we were. So it's probably around 10%, I believe. Because remember, at one point we came from 15%, and that's why we were a little hesitant to go directly after the protect our neighbors variance. But so that 5% increases with each level of variance that we're at. What we're most in danger of going beyond is our number of cases per 2-week period, because we are at 482. Remember, we had to be at 150 under protect our neighbors. So that's the thing. In fact, I called Deanna this morning. That's what I'm most concerned about, is that's, we're not going to see that drop anytime soon. In fact, the letter from the state last week said, even with your 5-star program, we'll monitor it for 7 days to see if it's effective. So if we go to the level 2, so it's level 1, then level 2, then level 3, that'll have to tighten us up a little bit more. But I will really advocate to keep that 5-star program, because, and that's what I said back to the state. Give me your logic on telling us that we would lose that, because those are the places that we've deemed to be the safest, and there's no reason to pull those down. So that's the one good thing that we have through this, is that we've got that flexibility for that program. So even if we had to shift to other variances based off of numbers, we're consistent with the 5-star. I'm hoping.
Now, when we have an outbreak, for example, at a nursing home, or if we have an outbreak at some of the other places where we've had a lot, like the bars where dancing occurs, or concerts and so on, are they immediately recommended to try and do what's necessary to get into a 5-star, or are we meeting resistance, or how do they clean up their, or, we have a couple in mind, how do they clean up their act, or are we seeing some defiance out there?
I don't think we're seeing defiance yet. That's still to be determined, in the next week or so. But yeah, we work with those places. We want them to stay open, but they do have to implement some of those distancing sorts of practices, because, and we continue to see cases roll in from these outbreak areas. So it is very important for them to keep the distancing and the mask use in place, so that we can stop those new cases and then let them run out their 28 days so that they're no longer an active outbreak.
How do we determine, for example, where we have somebody that, let's say, in a nursing home that has a do not resuscitate and they pass away, are those people, is there then some kind of test or autopsy or something to determine whether or not it was COVID, or it was a combination of illness, or it was just age?
Well, I'm going to answer that question, but Victor will probably roll his eyes, because he's sitting right back there. He's the one that makes that determination. If COVID wasn't the cause of death, then we don't count it as one of our deaths. And that was really based on some criticism that the state got early on, that everyone who had COVID was then part of that list, cause of death. So we've had some deaths here in Mesa County that the cause of death was an underlying health condition, but it was accompanied by COVID, and so that does not make our list.
I knew someone who was in a coma and had 3 strokes and died with COVID and was listed as a COVID death. Now, maybe the state subsequently backed off that. I don't know all the details, but that would be the question, because now with outbreaks at the nursing homes,
Right. That's right.
that's a real challenge.
Plenty of comorbidities with the nursing homes. Yep, that's for sure.
And have we limited the outbreaks to just a couple nursing homes, or do we have, what's our situation there, and is it a situation crisis yet, or critical, or we're still kind of yellow light, or what are we doing with the nursing homes?
Yeah, I think we're yellow. It's 2 facilities. I think we're maintaining. I expected some numbers to go up, a day or two even after those initial, and haven't seen those yet, but not sure if we're at a point where we've fully assessed or have fully gotten all the details and all the information. So.
And then one final question. Are most of the people we're testing now have symptoms, or people that just want to be tested?
Nope, they mostly have symptoms. In the past 2 weeks, actually, I don't have the 2-week number. The cumulative number for this entire time, we only have 182 people who have tested positive with no symptoms. So the vast majority, because we have 1,300 positive cases right now, so the huge majority of people that we're testing are going in there with symptoms and testing positive.
All right. Commissioner Puglisi, any follow-up questions or thoughts?
No, thank you, Mr. Chair.
Thank you, Commissioner. Commissioner Justman?
No, I guess not really, but on the other hand, as we get into the more winter months and it stays as we spend more time indoors, is it probably going to make the number of cases go up? I suspect. Is that true? Or?
Yeah, I think it will definitely add to it, but and I've mentioned this in the past, our biggest issue are gatherings. You can see that from the number of family members who are infected, so those are family gatherings, and then impersonal gatherings, or informal gatherings, and that's the area, and I think that's why the state did issue that order last week that limited impersonal gathering, informal gathering sizes to they may be impersonal, but they're informal, to 10 people. Now, how do you control that? That's a whole thing, but definitely that is our biggest issue right now, and that's why I think people need to protect themselves. So knowing when you go to these sorts of gatherings, know that there is a risk there, or, if you're just going out and about, we've got such wide community transmission that I think people need to be very aware of protecting themselves when they're out and about.
So right at the moment, what county is the hot spot of the virus in Colorado?
I don't know the answer to that.
No, they're probably, we're all
Yeah.
struggling along with it.
Yeah, it's all very hot. I just talked to one of the public health directors from up north this morning, as a matter of fact, and she's ready to lose her Protect Our Neighbors variants also. So it's everywhere. If you look at the national data, Colorado is one of the states that are on the rise. So,
Thanks.
you bet.
All right. Dr. Kerr, once again, thank you very much, and give your staff our regards, and we should certainly appreciate your leadership.
All right, thank you very much.
Thank you, Dr. Kerr. All right, next, we're going to do a presentation. We have the Mesa County Department of Human Services, Tracy Garcher. If you'd identify yourself for the record, you may proceed.
Yes, sir. Thank you, Commissioner. Tracy Garcher. I'm the Executive Director for the Department of Human Services for Mesa County. So, haven't been up here yet in front of you guys since COVID happened. Certainly, it has had a pretty big impact on our department. I want to thank Jeff again for his leadership. We share the same facility, and we've just been able to work hand in hand with him and his staff on this. And so it's helped us, given the fact that we're out in the community a lot, or the community is coming to us a lot. So being able to not only make sure that we're helping the most vulnerable folks in our community be safe when we're interacting with them, but also our staff, it's been really good. So I guess what I would say, no different than a lot of other businesses or organizations, the immediacy of having to really just absolutely change the way we were doing business at the drop of a hat. We were having hundreds of people darken our door every day coming to us for something, and that had to stop. Simply has nothing to do with the virus. Everything has to do with the virus, but it had more to do with our physical, the layout of our building. So immediately we learned all sorts of things about how to interact well with people or not. We just didn't, either at the workforce center or in our lobby, it wasn't big enough to have droves of people sitting there waiting. So we literally, what I would say is the lesson or the takeaway that we've had with this whole experience is to be flexible, to be innovative, and just got a wonderful staff who's just met this challenge from all different aspects. So we started doing that. We immediately had to shut our doors because we could not interact with our customers, our clients, the people we serve in a safe manner and ensure social distancing. It wasn't possible. So we actually drove them to use the tools that have been there all along. We had some state help, though. Before, the state wasn't nearly as stringent in allowing us to force people to go to the website, to use the phone, tools like that. And so whenever we had a rough couple of weeks on all fronts, trying to get our customers and Mesa County citizens. Again, these folks were hungry. They needed stuff from us, and that's why we're there. But to get them to change the way they sought the service as well. And I'd be surprised if your other departments aren't reporting the same thing. It was a little rough, just like we all have trouble, learning new things. But once they started accessing those online tools, we were actually able to help them quicker because our staff weren't bogged down trying to answer phone calls, trying to deal with customers that were unhappy and upset. They were actually able to do the work. The applications and things that were coming in contained the right amount of information, and we were able to actually get caught up and handle that initial surge a lot easier than if we would have continued to let people come into our shop. So that was something that was kind of surprising, but that was the reality. So that required a lot of stuff. So our folks that typically took applications and papers in at the front desk, we didn't need them anymore, right? So they started scanning our mail and pushing that out to people that needed it out in the field. And so we kind of had to rework some things internally. So that was neat to see that happen. So our internal support services, as I'm sure, I'm looking at Pete, he handles that here. We always, and thankful for our frontline folks. I see the sheriff in the audience. Very, very thankful that those folks are out there on the front lines. But I think some of our unsung heroes in this whole process are the folks in the back office that have had to keep up with all of these changes and stuff. So we got through all of that, and really, when for the people listening today, when you look at the Department of Human Services, we're a big, complex organization. To boil it all down, we really do three things. We do safety, we do stability, and we do meaningful employment. So when I kind of take, what I want to do is run some of these numbers by you guys to give you some context of kind of what we do in those areas, and then hopefully this is informative to the public as well. So safety, that's our adult protection and our child protection. One of the things that happened to us, and Jeff was just talking about it this morning, was access to folks whenever in a pandemic. So the nursing homes almost immediately shut down, and wouldn't, very similar to hospitals, really wouldn't allow people in or out for fear of the virus to those at-risk populations. So that was a huge challenge. Whenever there was a possible allegation of neglect for our elderly, trying to figure out how to make that happen. Multiple calls and discussions with the state, figured out how to do it, or I would say just now are really getting to a point to where the facilities are comfortable working with us. But those poor folks, they look like somebody out of a space movie. So they have to get on the full protective gear and go in to protect themselves and to make sure that they're not spreading something. With the kiddos, it's been a little bit different. And this kind of shows you how all of this stuff's intertwined together. So first, I want to assure everybody that's listening, and as well as you guys, that we've always paid extra special attention to abuse or neglect, the safety of kiddos. So I know it was mentioned several times, and our concerns went up because these kids, school stopped, right? And one of our bigger mandatory reporters are teachers. I mean, they see our kids often more hours a day than we see our kids. And so whenever there was any concerns, we got very, very close working the relationships with the schools. They'd reach out to Joe and his crew, and we would process through that. Well, with them not going to school, our referrals dropped significantly. So in January, we were averaging about 700 calls to our hotline a month, and that dropped down to just a little over 500 in August. Referrals were about 460, and that was in January, dropped to 394 in August. But here's what I think gives us confidence, and I hope people do have confidence in the system, is that once we get past that drop in initial referrals, our assessments and removals and things like that are pretty stable. So out of the almost 700 calls, we only ended up assessing 107 of those, because that's what met criteria. And then we have the 550 and assessed 111. So still nothing, came up or what I would say slipped through the cracks. And people are wondering what that means. I mean, this is the serious stuff. This is where kids die if we don't do our job, right? Or can be significantly hurt. So very, very thankful that the networks, law enforcement, everybody out there continued to do their job looking at and for those most vulnerable situations. So never stopped. Whenever we had a referral that met the criteria for an assessment, those have to be done face-to-face. So we never stopped doing that across our entire department. We never stopped doing any of our services. So we continued. We just did them very differently. And so this is where, you hear everybody say things like, change drives innovation and things like that. And as hard as it was for us to get up every morning and look COVID in the eye and try to figure out, okay, are we going to have a workforce? Are we going to do this? Are we going to do that? We had some significant wins, and that can be attributed to COVID in child welfare. First, Joe was able to, we had on hand and working with IT, able to get iPads, right? And we put those in the hands of foster parents and kids, and they were able almost on a nightly basis to have, it's something different through Apple, but kind of like FaceTime or that, where you can literally do a video there. So kids were able to do that with their parents almost on a nightly basis, which is very, very important for the reunification process. Again, when safe, right, and when productive, things like that. We were able to get some variances with the state so that Joe and his crew, his workers didn't have to go clear to Denver to do monthly face-to-face visits. Got some stuff working with Patrick's staff with the courts, and got some stuff that I wouldn't say it's useless, but it certainly didn't have a direct improvement or positive thing towards the case. We were able to get the courts to agree to let us not have to do some of that. So that was just within our safety realm. So we're doing really good there. It's going to be interesting to see if the schools shut back down, what happens, but it's also really, really strengthened our relationships with our community partners as well. So stability is our public assistance. And what we've seen there is, again, to give you some of the numbers, so Mesa County, and again, I just looked this up over the weekend, so I think these are 2019 census numbers. So somebody's probably got a number they like better, but for this presentation, I'm going to say Mesa County's got about 154,000 people in it, and we've got right around 61,000 households. So our food assistance cases in January were 8,691. In August, they're 10,245. As far as the value of that food assistance, in January it was $1.9 million, and in August it was $3.48 million. So part of that is absolutely people applying for assistance. The other part of it, though, is the state of Colorado opening up some waivers and essentially paying people the maximum amount of benefit and not allowing anybody to come off. So we've got these caseloads growing and it's a bit misguided to think that we're just growing those as a direct cause of the economy, although that has impacted it. Our next, because when you look at the numbers, our applications in January for food assistance were 1,054. In August, they were 836. So we've got this weird wobble going on, where we have fewer people applying, but the value of the benefit is higher, and that's just because of some of the waivers that the state has passed. Next big group is Medicaid cases. So that's folks, Medicaid is health insurance. 21,560 households, so not individuals, but households. Again, 61,000 households, so roughly a third in January on receiving Medicaid. In August, 24,000. Individuals, so within our public assistance, because it's on the same computer system, we can get an unduplicated count of individuals. So there were 38,763 unduplicated individuals, men, women, and children, receiving some form of public assistance in January. Right now, 45,163. So definitely it's gone up a little bit. What I would say there is we've just really learned how to make sure that our websites are up to date. The state's website is up to date. We've worked with county IT almost on a daily basis, so we really appreciate their help. I think they've probably been helping all of us get our information up to snuff, if you will. So I think our key, again, there is just flexibility and probably, I hate to say coddle, because that's not the right word, but I think we need to be tougher, or maybe a little sterner whenever we're saying, look, to our public, because remember, these are Mesa County citizens, right? They're folks that, we're meeting in sometimes their worst days when we get to meet them. So it's trying to balance that with a wealth of information that's out there and available, because when people use those tools, it gives our people more time to actually do their job. So we're going to continue to look at that. I think maybe there's an opportunity to kind of rebalance some labor in there somewhere. Maybe not, but I can't not look at it, right? Then the last one, what I always say is meaningful employment. And what I always say is if we did not have the Workforce Center as a department, we would be the welfare office. Our Workforce Center really allows us to work with people who come onto public assistance, assess their ability to work, assess their skills if they got laid off, and rework, retool, retrain, and help them find opportunities to find a job and not have to be on public assistance. So that's one of our primary functions that we do, and so we talk very openly about that. Workforce Center has been extremely busy. Again, when folks start losing their jobs, that's kind of the tip of the spear, right? And if we can get around them, get them the different training and tools, their ability to get back to work improves greatly. So again, there we had that huge federal, and then our 2 rounds of federal unemployment, which is if you're unemployed, it puts some cash in your pocket. That never helps us when we're trying to get people back to work, especially some of the lower paid jobs. But the crew at the Workforce Center got very, very creative. They have the same problems we do as far as social distancing. So we're able to actually have people work from home. They took I think they had phone banks or something. Again, IT helped us solve problems. And so they were able to actually go home and have the same phone capabilities that they do, transfer calls and everything that they would work in here. And then we did stuff outside. So just a couple of weeks ago, I think maybe last week or the week before, September was Workforce Development Month, and we actually held our first ever outdoor job fair. So, I mean, it looked kind of like farmer's market. And it was kind of, we didn't know how it was going to work, but it worked super good. The weather cooperated with us. We had all kinds of pop-ups. 21 employers and almost 200 job seekers went through that thing. So they just never stopped. And again, couldn't be more proud of my folks for stepping up, being innovative. They didn't, well, I mean, everybody griped a little bit. I think I'd gripe every once in a while about COVID, but for the most part, just said we have to learn how to do business differently. So that's my report.
That's very complete. Thank you. Commissioner Jessup, would you start us?
No, thanks for providing all the data, and it was interesting how the cases went up from January to August. Not surprising, but the number of huge increase in workload for you and your staff and the dollars involved. So
Yeah.
it's unusual times for sure, and hopefully we don't have to go through this a year from now.
I hope so.
Thanks.
Thank you.
Commissioner Puglisi.
Thank you, Mr. Chair. Yes, I agree. That was a very comprehensive report. Thank you very much. I think the data is really helpful, obviously, as we're working on economic development in our businesses, but also to make sure our children and elderly are safe during these crazy times. So thank you and your staff for all that you're doing, and thanks for the information. Thank you, Mr. Chair.
Thank you, Commissioner. Tracy, so I was interested in your remarks where you said the state program, this is on the assistance side of it, I think, but where the state mandated that people couldn't go off the program.
Right.
So while you have requests for assistance, maybe not growing at the same proportion or going down, nonetheless, the programs, and you said that was an awkward, I mean, what is the state doing? So if somebody's got a job and they don't need assistance anymore, although they had previously qualified for assistance prior to getting this job, they now get to double dip, they get the assistance program and the pay from their job?
Well, yeah, they do. I mean, I would certainly, yeah, I wouldn't be critical of the people receiving it. I think the state is just, it doesn't, to us, we have always been on this side where if you need assistance, come and get it. Because like we were talking about the job, the longer people go without assistance and help and really slide and hit the bottom, the harder it is for them because they lose hope, right? And that's the biggest thing. When
The question is,
yeah,
to go without assistance
right,
if
so,
they need assistance.
right,
Let's
so
say
so
they- okay.
right, so then we also are very, very huge advocates of once you get that job, get off of it. So that's Mesa County. So why this? I think the state just thought that that's how they could help some of the poorest folks out there is to just keep them open, give them the maximum benefit. Because two things happened. They didn't close the case. Right now, everything's on a sliding fee scale. And I'll probably get these numbers wrong, but it's pretty darn close. So a family of four, I think you can make up to like $2,600 and still qualify for food assistance. And the maximum food assistance amount, I think, is right around $600 a month. So here's what people get wrong a lot of the times, and they say, oh my God, I can earn $2,600 or $2,599 and still get $600 of food assistance. No, you cannot. If you're earning $2,599, the most food assistance you're going to get is like $12. So it's a sliding fee scale, right? If you earn zero and you have a family of four, you get your $600. So most people don't. I think our average food assistance is like $240 a month, something like that. And so what they did was you're cruising along, family of four, not only, so they took you up to $600, and then if you got your job, they said that doesn't matter until the governor removes his state of emergency, you're on it. So I believe that just happened like a couple of weeks ago. So we're starting now, just now, to start working on the food assistance, right? But Medicaid is still open, and it probably will be until after the first of the year.
So are we setting people up kind of for economic failure because we're putting them to, they've
That's
got their
the question.
job, now we're giving them additional government assistance. So naturally, when a family has more money coming in, they adjust their lifestyle or they spend to the higher amount. Then all of a sudden, we pull the carpet from under them and say, okay, now back to what the rules were supposed to be. You don't get your
Right.
$600 a month or
Right.
something. Or
So,
whatever.
yeah, is that a possibility? Certainly is, and it's something they call the cliff effect. So we're trying to educate folks as much as we can and say, don't count on it because this would have been the amount, et cetera, et cetera. So, It'll be interesting to see what happens. I'm hoping not.
Well, I think you've done an outstanding job in your team out there as well, and we
Thank
appreciate
you.
it very much you coming in today. Commissioner Puglisi, anything further?
No, thank you, Mr. Chair.
Mr. Justman?
No, thank you.
Okay, thank
All
you
right,
guys very
thank
much.
you very much. All right, next we'll go to our commissioner reports. Commissioner Justman, you want to start us?
Last week, I met with the sheriff and on a budget request that he had. We also had our Presigo meeting. Had a call-in with Associated Governments of Northwest Colorado and the Federal Mineral Leasing District, and also went to McGinnis Canyons. I took the long scenic route, but I did get there, and it was a beautiful, beautiful day and to have it, and the turnout must have been good, but I missed quite a bit of it, but I'm sorry for that.
Well, so I told somebody, I said, if you want the dictionary or the computer for roads in Mesa County, Commissioner Justman's the right one. So he knew where he was. He just didn't know where the event was.
Well, McGinnis Canyons is down on 2 Road.
Well, it does. It goes a long way. So we appreciated your attendance there. Commissioner Puglisi.
Thank you, Mr. Chair. I met with Chelsea Mira of the West Slope Colorado Oil and Gas Association to talk about some upcoming testimony that I'm going to be doing before the Colorado Oil and Gas Conservation Commission on federal lands and the interaction between federal lands and oil and gas community. And then I obviously been doing a lot with national popular vote this week as the election is coming to an end hopefully soon. I met with Jeff Core to talk about our COVID response. And then obviously Presigo meeting, I thought that was really interesting and actually one of our more productive ones that we've had in a while. Thank you, Commissioner McGinnis, for all the work you've done as the subcommittee to get us to that point. And then still working on opioids. We had kind of a step back because municipalities didn't feel like they were being engaged. I am working with our municipalities to talk to them about the opioid settlement and some of the different structures that there might be, but not all communities are doing that. So we're taking a step back to make sure everybody's on the same page on the local government level. And that's the end of my report. Thank you, Mr. Chair.
Thank you. All the commissioners are working. This obviously is budget season, so we're spending a lot of time with Pete and in our own time looking at the different budgets, and obviously it's complex, but fortunately this happens every year, so it's not like we're plowing new snow. And although we got a lot of new snow, in fact, I'll bet we got as much snow last night as, we got 4 inches or 5 inches?
I would say.
That'd be maybe a third of an annual average or something. We got a lot of snow, so that was great. But anyway, just numerous meetings. We'll go ahead now, move on to the county administrative report. Pete, do you have another report for us, please?
Yes, thank you, Mr. Chair. Quickly, I will touch on snow plowing. We had over 20 pieces of equipment out last night, and I know the drivers were out, had a little rest, and went back out again. So, and we also had a construction crew out, mainly for the downed limbs. I think many people saw there were tree limbs that were breaking due to the weight of the snow. Like to also mention something good that came through our emergency manager's office and Andy Martzoff. We did receive approval on the Mesa County Hazard Mitigation Assistance Grant Program, and that covers Mesa County, City of Grand Junction, and Fruita, towns of Colburn, Palisade, and DeBeck, and our Lower Valley Fire Protection, Plateau Valley Fire Protection, DeBeck Fire Protection, and Grand Junction Rural, and Clifton Fire Protection. And why this is so important is this allows grants up through October 19th of 2025 for hazard mitigation, including our recent fire that we had with Pine Gulch Fire and such. So kudos to our emergency management group getting that through and ready and helping with those communities. Then as mentioned, just continue working finance and budgets, and also attended the Presigo meeting. So that's my report there, Mr. Chair.
All right, thank you. We'll go ahead and move to our consent agenda. The consent agenda is intended to allow the board to spend its time on more complex items. These items are generally perceived as non-controversial and can be approved by a single motion. The public or board members May I ask that an item be removed from the consent agenda for individual consideration? Today, we have two items on the consent agenda. Item number 1 is to approve an amendment and extension of a grant agreement from the Colorado Department of Human Services, Office of Behavioral Health for the Colorado State Opioid Response in the amount of $95,786. Authorize this chair to sign. Second item on the consent agenda is to approve a contract between Mesa County and Colorado West Contracting, Inc. for the Clifton area cleanup in the amount not to exceed $158,511 and authorize the chair to sign. Commissioners, would you prefer to have either of these items on the individual versus consent? Commissioner Justman?
No, I'm fine with them on consent.
Commissioner Puglisi?
No.
All right. I mean, there's anyone else anyone in the public that would like to have any of these items moved from consent to individual? Seeing none, that is the consent agenda, and the chair is open for a motion.
I'd make a motion we approve the two consent agenda items as presented.
Second.
It's been moved and seconded. All those in favor indicate by saying aye. Aye.
Aye.
The motion passes.
Aye.
We got that last aye. We got it. All right. We'll now move to items needing individual consideration. We have one item today for individual consideration. We do ask the public limit their comment to a maximum of 5 minutes per speaker unless otherwise restricted by the chair. The first item is to adopt a resolution to approve the Public Trustees 2020 third quarter financial report. We have today Sheila Reiner, our treasurer and public trustee. Thank you for coming. If you'd identify yourself for the record, you may proceed.
Thank you. Mesa County Public Trustee and Treasurer. I put together a presentation. This will be my first quarterly report to the board. If I can figure out how to get to the X drive. Maybe it's not logged in. Well, in any event, I put forward in public record a presentation which outlines what I will talk about. And the bottom line is that we are, for the first quarter of this year, 2020, going to be able to write the county a check out of the public trustee funds. We are starting to turn the corner. It was a losing business the first 2 quarters this year. That had to do with our numbers being down significantly in the foreclosure area. And also, there were additional expenses incurred while we had an overlap of my staff training and the state-appointed or governor-appointed public trustees still on the payroll. So those were quarters where we lost, essentially, money, I guess, that wasn't cut to the county, and now we're going to turn that around. We have less expenses now, and things will get better. We have a higher number of releases being processed and a lower number of foreclosures being processed this year. That has to do with the fact that the moratorium on federally funded mortgages are stopped. We can't start new foreclosures until the 1st of next year. Most of the foreclosures we have in our system right now are set for January 6th, 2021. So it's going to get really hairy the beginning of next year unless that is extended again. And as far as the releases go, the mortgage rates are down, so everybody's refinancing, which increases our workload significantly in that area. So those are the things going on in the public trustee's office. And then the other thing I wanted to mention is that I'm preparing to handle the load in the most efficient way we can, and also benefit the homeowners that may be facing foreclosure early next year. And that is going to be taking the foreclosure sales online with the same company that we use for our online tax sale. So that is going to be coming to Mesa County. There are locals that are not in favor of that like to come here in person and bid with the same little bidders group for the foreclosed properties. And while I appreciate that, I also recognize that part of the job of public trustee is to get the most you can for the homeowner that's in a bad situation. And we don't get the number of bids we would otherwise if people could do it remotely. So there's a few reasons for going to the online setup, and many counties in Colorado are doing that. And I hate to blame it on COVID, because I don't think that's the only reason we should consider, but that is another benefit, that if there are any type of pandemic outbreaks in the future, the fact that your foreclosure sale would not be in jeopardy of being held is another bonus to doing that. So those are the things that I was going to talk about. I'm sorry I don't have my slides and didn't prepare well to do that, but that's pretty much the report that I was prepared to give you guys.
Well, thank you very much. Commissioner Puglisi, questions?
Thank you, Mr. Chair. Thank you, Sheila. I am able to pull it up, obviously, online. I think the numbers are looking good, and I just want to say thank you. I know that there was some uncertainty about this transition from the public trustee's office to the treasurer's office, but I think that you've done it pretty seamlessly, and I do think we're going to realize a lot of efficiencies by doing that in the future. So thank you for sticking with it and being patient. I'm glad to see foreclosures are down, but clearly there's some outside forces on that, and that releases are up. So hopefully the process will continue to go smoothly, and I like your idea of online foreclosure sales. We do that with trustees' deeds and liens as well, so it makes sense to bring that both in line. So thank you for trying to be innovative and finding efficiencies. Thank you, Mr. Chair.
Thank you. Commissioner Justman.
Well, thanks for the report, Sheila. So with the COVID virus, has that slowed down some of the foreclosures that might be on the books and coming our way, or has that been a factor in if the county's going to get a check, approximately what kind of dollars are we talking?
Thank you, Commissioner Jessman. The foreclosures have slowed because of COVID. Certainly, there has been executive orders issued by the governor that have put a moratorium on federally funded loans. You can't start a foreclosure at this time. And because of that, other banks have been less aggressive and have done their own thing about leaving people in their property longer. So that has definitely slowed the foreclosure rates down this year, I think nationwide. The thing that is saving the bottom line for the public trustee's office now is we get $15 for every release of deed of trust that we're processing. So our revenues are okay, but we will see an uptick in the more expensive processes when we get foreclosures back online, which I think will break loose in January unless there's some sort of an extension.
Okay, thank you.
You're welcome. And I wanted to say something to Commissioner Puglisi's comments as well. Going into this transition, I was definitely not understanding the realm of what I was about to take on. And I think that you guys were right in the guidance that you gave and the direction that you gave, because once we got into it and understood what we were taking on, and we've been successful with Attorney Coleman's help through some legal things that we've had to sort out, it's really worked out for the best in the long run. And my staff has been able to absorb the majority of the work, and we may only have to bring in somebody temporarily when we hit really, really busy times. So I appreciate working with you guys through that.
It'll be much more efficient for the county.
I think it will.
Good.
Well, Sheila, thank you very much for your leadership. I know it's been, wow, you've had your hands full, but the transition seems to have been very, very smooth. In fact, I haven't had, I'm not sure any of us have had any kind of complaints at all, and so good work. Thank you very much.
You may get a few complaints about going online.
Well, and you did this, you didn't, but your predecessor years ago with the property tax sales, and it enhanced the revenue for the counties, and it's, people don't want competition. And it's just more efficient way to do it. It makes a lot of sense in a lot of different ways, but I would expect complaints from that. But anyway, thank you very much. Thank you for your leadership. Your staff's doing well. take it?
Yes, we
Helping?
had, actually, last week, we had one staff member test positive for COVID.
Yes.
And then another come down with a very well-timed fever, but it was unrelated. So we had a little bit of a scare last week on kind of trying to plan mitigation and how we were going to handle that, but I think we're okay. We actually are continuing with some staff working at home and some in the office, and we're able to keep our doors open. So that's the good news.
Well, thank you, and give our regards and wish better health to the one that's tested positive.
Thank you.
Thank you very much for your time. All right, Board, that was a resolution, so the chair is currently open for a motion. Do I have a motion? Commissioner Justman.
I'd make a motion we adopt the resolution to approve the Public Trustees 2020 third quarter financial report.
And do we have a second?
Second.
It's been moved and seconded. All those in favor indicate by saying aye.
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 The resolution passes. We're now going to adjourn as the Board of County Commissioners and reconvene as the Board of Human Services. The Board of Human Services has one set of minutes to approve. Actually, we have two sets of minutes to approve. Our first one would be July 6, 2020. Our second set of minutes is October 5th, 2020. Commissioners, if you have no changes, the chair is currently open for a motion.
I'd make a motion we approve the July 6, 2020 and the October 5th, 2020 minutes as sent out.
Second.
It's been moved and seconded. All those in favor indicate by saying aye.
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 The minutes are approved. We now have the consent agenda. The consent agenda is intended to allow the board to spend its time on more complex items. These items are generally perceived as non-controversial and can be approved by a single motion. Public or board members may ask an item be removed from the consent agenda for individual consideration. Today, we have one item on the Board of Human Services consent agenda. Approve a contract between Mesa County and Project 1.27 for foster care retention and recruitment in the amount not to exceed $64,720 and authorize the chair to sign. Either commissioner would like to move this item to individual.
No.
No.
And is there anyone in the audience? Actually, I don't think we have anyone left in the audience hardly, outside of staff, but anyone wishes to move that from consent to individual? Seeing none, that is the question before the chair, and the chair is open for a motion.
I'd make a motion to approve the consent agenda as presented.
Second.
It's been moved and seconded. All those in favor indicate by saying aye.
Aye.
The consent
Aye.
agenda is adopted. And we have no items on individual. We're now individual consideration, so there's no further business for the Board of Human Services. We'll adjourn as that, reconvene as the Board of Mesa County Commissioners for unscheduled business, which is the only remaining item we have today. And we really have no one in the room for unscheduled business, so there will be no unscheduled business today. My fellow commissioners, do we have anything, Commissioner Puglisi, anything further?
No, thank you, Mr. Chair.
Commissioner Justman?
No, and I would have to say that on the west end of the valley there, the Mesa County Road Department did a good job. The main roads that people were using were really in good shape, I thought. So they were out plowing last night, and they did a good job, and I want to thank them.
Yeah, they did a great job, and I'll tell you, the city's got their work cut out for them when you drive down these streets. I saw one big one laying on top of a truck, and they're all over, all these
Yeah.
trees.
Branches.
There's a lot of weight in that snow, but I don't have anything further, but I do want to, Commissioner Puglisi, thank you very much for going the extra effort. Are the kids there with you?
They are.
I thought I heard one of them vote with you just a minute ago. So we had 4 votes. So we really had a unanimous decision there. Anyway, thank you. With nothing further to come before the board is now adjourned. Yeah.